may I come in? Okay, hi. Hi, my name's Mary Jo Frickville, and I'll be taking care of you. Today, I'll be working with your primary nurse, and my instructor might be popping in periodically. Can you tell me your name and date of birth? Name and date of birth, just make something up.
1395.
Okay, all right. So check her armband, make sure she's hurt. How you feeling, first of all?
Fantastic.
How'd the delivery go? A little rough?
Fantastic.
Good, all right. How's the baby doing?
I don't know.
And can you tell me, what the baby's name is? Emily, love that name. Okay, perfect. Well, I need to do an exam with you. Just need to get a set of vital signs. People want to know what you're going to do, right? I'm going to do a set of vital signs. I'm just going to listen to your heart and lungs and bowels. Check your uterus, make sure it's staying nice and firm. Check your bleeding and your stitches and your circulation. So I just need to do a brief head to toe assessment on you, and then I'm going to assess the baby after that, basically doing much the same type thing. So I'm going to go ahead and get started. I'm going to do what am I going to do? Temperature, pulse, respirations, blood pressure, and pulse ox if it's a C-section. It has been less than 24 hours, okay? Okay, so I've got those vitals. What I want all of you to do is make sure you know what normal vitals are, so that you know, otherwise you might as well not take them, right? So know what normal vitals are for a baby and also for a mom. Very important that you come, because I might be asking you what they are when you're at clinical, okay? So your vital signs are stable, everything looks very normal. I'm going to go ahead and listen to your heart, lungs, and bowels. So remember from health assessment, you ask the questions and then you do the exam, right? So can you tell me if you're having any difficulty breathing, any cough, any shortness of breath? No?
Nope.
Any chest pain?
Nope.
Okay. And then as far as your tummy goes, are you passing gas?
Nope.
Okay, no gas yet. Okay, so we want to encourage you to get up and walking. That'll help things get rolling along, okay? And have you emptied your bladder recently?
Nope.
Say yes. Answer's yes.
Yes.
In the last hour? Yes. Okay. All right, if she says no, after the vitals, you'll take her to the bathroom, you'll tuck her back in, and then give it a little time, and then come back and do your assessment then. Otherwise, you might find a uterus up and off to the side. Does that make sense? Okay. So I'm just going to listen to your lungs. If you can take a nice deep breath every time you feel my stethoscope. Better be on the skin, but you don't have to pull her dress down to do it. Like tuck it in if you're going to do that. Okay, give her as much privacy all the time as much as possible. Now I'm going to listen to your heart, and I'll listen to the 5 spots. You remember this from health assessment, right? All right, I'll pretend as they're in. It works better when they're in, right? So, second right, aortic. Second left, pulmonic. Third left, Erb's point. Fourth left, tricuspid. And fifth left, mitral, okay? Don't go too fast or you won't hear a murmur if there is one. Okay, I'm gonna flip it around. Again, second right, stay off the sternum or you won't hear anything. Adjust your stethoscope so you can't hear anything. Second right, for aortic. Second left, pulmonic. Third left, tricuspid. Excuse me, Erb's point, tricuspid. Is mitral, okay? So that's, you're listening to the heart with your bell and your diaphragm after you've listened to the lungs, okay? I'm just gonna listen to your tummy. You say you're not passing gas. Most people would say they were, but if it's a new C-section and she's fresh, she might not have good bowel sounds yet. And she might not be passing gas yet. That's usually a general though. Honestly, the spinal seem to have bowel sounds quicker and pass gas quicker. But you're dividing it into 4 quadrants. And I know there's a right way to go around this, but I can't remember, so I'm not expecting you to. So, 4 each chart, there's no vowel sounds. Talk to the instructor. If there's something abnormal that you find, make sure you verify it with the instructor before you chart. Okay, so vowel sounds. Okay, so I'm gonna go down and check your legs, and I do this because to check your uterus, she has to be flat, and to check her stitches is best when she's flat, but they don't like to be flat for longer than they have to, so I go down to the legs next. Alright, so there's 7 major things, and you can add clonus and you can add reflexes, which you won't check on everybody unless they have a blood pressure problem. Okay, so the 7 things are, you're looking for swelling, and if they're having it, you're gonna push down to see to what degree it is, and she'll tell you if it's getting worse or better. So you're looking for swelling, color, temperature, pain. Any pain in the calf? Either one of them? Trying to feel for a warm reddened area, okay? So those are the 4 things up there. And then I'm gonna do the pedal pulses from the great toe right here up to the top. You can feel one and add the other, but eventually you have to say they're equal bilaterally, normally, okay? They should be +2. That's the pedal pulses. This medial malleolus behind that. It's posterior tibial, so I grab it, my finger is kind of behind the ball, in the middle. They should be +2. Okay? Capillary refill should be less than 3 seconds, okay? So, we're talking about pedal color, temperature, swelling, any pain in the calf, right? Pedal pulses, posterior tibial pulses, and capillary refill, okay? If you do them in the same order, you won't forget any of them. If you do them in a different order, you will forget something probably. So I'm looking for a reflex hammer. Of course, I would have brought my supplies all with me, so I'm going to do it in the patient's room. Doesn't really instill confidence. Okay, and remember from health assessment, right? And I think they're harder to get. Try it. If you have something that you could use as a reflex hammer at home, you could try this. I always found that was when I was teaching health assessment, if I had them pull the same time I tapped, then they relaxed and you could get the points. Okay? You can try whatever you want to try. Make sure you take it all or weight. Okay? And then, you know, I would say like, okay, get ready to pull your hands. 1, 2, 3, pull. Okay, it should be +2 for normal. Pulses are also +2 for normal. Okay. All right, so always check both sides. All right. And this is if they have a blood pressure problem. Okay, +2. All right. And then clonus is something that occurs when someone has a blood pressure problem. And when you move the foot, dorsiflex the foot, it'll tap back on your hand. So you do this like that, and it goes like that. That's clonus. And you base it on how many beats of clonus, how many times it taps back on your hands. Hopefully you won't find any of this, but it's something to check for anyway. So you just dorsiflex the foot and see if it taps back on you. It shouldn't. Okay? All right, so that is the peripheral assessment. Okay, again, if she had a blood clot in one leg, it probably, she might not have all these things, but she might have some of them, a reddened area, poor pulses distally, okay, poor capillary refill, pain, redness, swelling, more so than the other leg. That's your point of reference. Questions? Okay, so, after this, I would say that, I'm gonna put you flat in bed, and you also ask her about pain. Put your flat in bed. I know you don't like this. I'm gonna have you bend your knees. Be careful not to pinch yourself, you guys, when you're practicing. Okay? I'm gonna stabilize the lower uterine segment. Why am I gonna do that again?
Prevent prolapse.
Yes. Okay, so I'm gonna stabilize like a smile right here. All right? And I'm gonna roll down. You're going down. Okay, this is flat, but this is rolling down, trying to feel the top of the uterus, which is known as the
Fundus.
And it should be 3 things. It should be
Firm, midline, and looking downward.
perfect. Yeah, so say you're trying to feel what feels like the top of a grapefruit and where it is in relationship to the belly button when you put your fingers like this. Do you feel it right at the top of it right here at the belly button? Is it 1 above or 2 above? Okay. Or is it maybe you feel it, you don't feel anything here, but you feel the top of the one below. So let's use /1. that make sense? Okay, so that's, I'm checking the uterus. Everything, it should be firm, midline, and moving down. That's what you wanna see. All right, I'm just gonna check your stitches. I'm not gonna make you do this, but I want you to talk through this, because the mannequin's pretty heavy. But I'm gonna have you roll on your side. I need to make sure your stitches aren't getting infected. I'm gonna make sure how much bleeding you're having, and also I'm gonna look for any hemorrhoids, okay? So she rolls on her side. At this point, if not before, you'll have gloved hands, okay? And you'll, again, wash your hands, wash your hands, wash your hands. So you're gonna pick up one cheek with gloved hands, and you're gonna have your pen light. You're looking for 3 things. What are they again?
Hemorrhoids, signs of infection.
Okay, what do we use for that? What's the
Rita.
acronym?
Rita.
Rita, okay. Hemorrhoid, signs of infection, how much what? Because we're looking for what?
Hemorrhage.
Okay, girl, okay. So you're looking for bleeding, and you hear about that based on when she changed her pad last, okay? If you see that she's got a full pad first thing in the morning, and that's been from all night, and it's dark, you're not so worried about that, okay? So that's the end of that. And I'm gonna fill up your water. Have you had anything to eat lately? Can I get you some, have you ordered some breakfast? Sometimes moms don't take care of themselves, you know? At some point you'll ask how she's feeling, how does the delivery go, how are things at home, and, you know, do you have support, or, you know, is there someone you can call to give you a hand with the baby? Those types of things, okay? Pulse ox, like I said, if she's less than 24 hours since she has C-section, or for whatever reason she might be destatting, okay? So that's, I think, most of what I wanted to show you with regard to the assessment. I'll take out my dirty gloves before I touch her side rail, and I'll wash my hands, right?